Nancy Newell here from the Strength House, and Jo Clair.
Yeah, from Protect Plate.
So today I want to talk about the importance of doing arm care before you get to throw. And before you even start the pre-throwing routine to throw, you always want to start first with a solid warm-up. A lot of kids will start to throw to warm up. It should be the opposite. You should warm up to throw so that you have the body's ready to actually go ahead and do a dynamic motion. So that's going to help decrease some injuries, which we want to stay as far away from that as possible. So today in this video, I want to talk about, in part one, I want to discuss the importance of setting your arm care up for success. So it doesn't matter how many arm care drills you do. If you're not in the right position, the arm care drill is not going to be as effective as what it could be. So I want to discuss the importance of setting your hips in a good position and also setting your rib cage in a good position. So a lot of times, if you go ahead and you see athletes do arm care, whether they're doing bands or anything, you're going to see oftentimes that kids like to compensate through their lower back. All right, so if they're always compensating through the lower back, we're not getting good external rotation. So you have to remember that we're trying to actually get the cuff to do the work and teaching good rhythm too with the shoulder blade, but that's going to be ineffective if all the motion is coming from the low back. So when it comes to a softball throw, you have your humerus here, okay, which is just, it's going to connect here to your shoulder. It's called your glenohumeral joint. So the humerus likes to sit inside the joint just like a golf ball in a tee, okay? And the main role of the rotator cuff is to keep the ball centered in the socket. It doesn't like it when it flies forward because then it kind of creates like a pinball machine, and that's where overuse injuries happen. So the main objective for the cuff is to keep that centered at all times, and that's kind of where all the drills are going to surround themselves with. So what we wanted to, I want to show you how we set up the half kneeling position and what you can look for when you go ahead and start your arm care drills. So say we're doing an external rotation here. What I'm looking for is true external rotation coming from the actual arm. So if Jo's setting up, she's in a solid position, she's got her hips underneath of her, she's got her abs braced, and she's just coming back to her position back here. So external rotation is when the hand goes back, internal rotation is when the hand goes forward. Okay, so we're looking to work external rotation. So she would go ahead, she would push and relax, and as she's doing this, what we want to avoid is we don't want to see the rib cage popping up to the sky and motion coming from her low back. So her arm can be here, but when Jo extends back, so you can extend through your low back. Yep. When she extends back, it looks like she's getting a lot of external rotation, when in fact, she's just moving through her lower back. She's not actually getting good motion through her arm. And she's kind of ingraining pretty poor habits. And when she goes to throw a softball, what she's gonna do is when she goes to throw, she's gonna lean back through her lower back, and she's probably gonna miss like high and arm side when it comes to the first base, okay? So we wanna make sure that the abs and the core is braced and the rib cage stays locked down to the pelvis, okay? So then when we go ahead and make motion, it's just pure external rotation and nothing's coming forward. The next mistake that people are gonna make is through like forward head posture. So what happens is you'll see the head kind of jut out in front of the body, and then it's gonna seem like she's getting more external rotation when in fact she's not. She's just shooting her head forward. And so those are gonna be the biggest things you wanna look for when it comes to setting up your arm care for success. So the hips are gonna be underneath of you. You should see a straight line running from the knees to the hips to the shoulders. And wherever the arm is moving, you don't see the rib cage shooting up, or you don't see any motion through here. We're just working right at the shoulder. So look for those two things, set your arm care up for success, and now we'll go ahead and we'll talk about what arm care drills to do pre-throwing.